Today, I'm going to speak with you briefly about uterine fibroids. My name is Shannon Fitzpatrick. There was a woman who complained month after month, year after year, about painful cramps, frequent urination, substantial bleeding, and sharp shooting pains through her pelvic area. As time went by, she began to notice a change in the size of her abdomen. It began to grow significantly. Her mother suggested she make an appointment to see her doctor, as she had suggested many times before. This time, the woman decided to take her mother's advice and pay her doctor a visit. After visiting with her doctor and receiving a physical examination, she found out she had been suffering with uterine fibroids. According to Johns Hopkins Medicine, in the second paragraph of the article, fibroids, an estimated 20 to 50% of women of reproductive age currently have uterine fibroids, and up to 77% of women will develop fibroids sometime during their childbearing years. Only about 1/3 of these fibroids are large enough to be detected by a healthcare provider during a physical exam, so they often go undiagnosed. Now, I guess it's safe for me to let you know, let the cat out of the bag. If you hadn't already predicted, I'm the woman in the story who suffered from uterine fibroids for years before seeking treatment. Today, I'll talk to you about uterine fibroids, what they are, their causes and symptoms, treatments as well for them. Let's first talk about what uterine fibroids are and what causes them. They can cause a big impact on your overall health if you are unaware and uninformed. What are uterine fibroids and what causes them? According to Cleveland Clinic, a world-renowned medical center, uterine fibroids are also called leiomyomas, which are growths made of muscle and tissue that form in or around the wall of your uterus. These growths are usually non-cancerous and are the most common non-cancerous tumors in women and people assigned at female birth. The exact cause of uterine fibroids are unknown, but healthcare providers believe the hormones estrogen and progesterone play a role. Most fibroids happen in people of reproductive age. Studies show that fibroids tend to grow when hormone levels are higher, like during pregnancy, or when hormone levels are lower, like during transition to menopause. Now that we've touched on what uterine fibroids are and their causes, let's discuss some of the symptoms many women suffer from with uterine fibroids. What are some of the symptoms of uterine fibroids? And what symptoms do women have who suffer with uterine fibroids? According to Mayo Clinic, many people who have uterine fibroids don't have any symptoms. In those who do, symptoms can be influenced by location, size, and number of fibroids. The most common symptoms of uterine fibroids include heavy menstrual bleeding, longer and more frequent cycles, pelvic pressure, or pain, growing stomach area, just to name a few. Those suffering with the symptoms from uterine fibroids can be hard. There are several treatments that are available for you that can aid in restoring your overall health. What are some of the treatments for uterine fibroids? Well, according to Medline Plus, the treatments you have for uterine fibroids depend on your age, your general health, symptoms, whether or not you're pregnant or if you want children or not in the future, and the location, size of the fibroids. Hormonal treatments can include intrauterine devices or iron supplements to reduce bleeding and prevent anemia. Surgery and some of the other procedures can include hysteroscopy, which is a procedure that can remove the fibroids from your uterus, or hysterectomy, requiring surgery to remove the uterus completely. Consulting with your doctor to discuss which one of these treatments and the many others available will be very beneficial to your well-being. I'm so glad I finally decided to listen to my mother this time and pay my gynecologist a visit about the symptoms I have been suffering with from uterine fibroids for years. Had I not, I would still be taking those iron supplements due to severe anemia and complaining about a number of other uncomfortable symptoms I have been suffering with. Today, I've given you an overview of what uterine fibroids are, along with their causes, symptoms, and treatments for them. After being informed about what uterine fibroids are, I hope this leads you to be more mindful of your bodies by keeping up with your routine checkups, paying attention to any signs your body may be alerting you of, and by all means, listening to your mother.